Okay guys, so I'm going to show you how we wrap a residual limb. The one that we are going to use, so this is a transtibial. We also have a transfemoral at school. You guys are going to get checked off on wrapping a transtibial, okay? So recognize that it's actually a lot easier to wrap it on a real patient where the leg is attached. This is actually a lot harder to do because you have to hold this leg positioned and taut somewhere. So my husband's going to hold this as if this were his leg, okay? So you're gonna have your patient extend their knee out. We want it straight when we are initially wrapping, remember, for our contracture prevention, and ideally they have it in a straight position and they're always keeping it in a straight position to maintain that extension. So with your limb wrapping, a couple of things that you need to remember, kind of goals as you're going over this. We need to make sure that we're always wrapping at oblique angles. So that's like cross-sectional angles. We never want any lateral wraps, anything that goes straight across like this, because that could potentially create our tourniquet effect. We don't want to cut off any blood supply. We don't want to cause any ischemia or tissue damage. So always oblique angles, usually like figure eights, are really easy to kind of remember which way you're going. We always want at least 2 layers of compression every which way on this limb. That's going to help give us adequate compression to help move this fluid and shape the limb. We always want to make sure that we have the most pressure distal working to proximal. So it should be the most taut, the most tight at the bottom of the limb, and then it can get a little bit looser as it works its way up. So for that, you guys, you need to make sure that every time you kind of swoop around, you're pulling it nice and taut from the bottom, and you can kind of let it go a little bit on your way up. So like I said, for these, you guys, this is like a double ace bandage. They're twice as long. This gives us multiple, wrapping layers for this, okay? So I'm going to kind of stop you every once in a while and pull this up so you can see from the top view. We're always going to start at our top angle here. It doesn't matter medial, lateral, whichever way you're going to go, it does not matter. But always start one side or the other here. When you're going to roll this, you guys, you are going to want to have it so that the roll is coming over the bottom like this. So when I'm wrapping, so you can see this, I want my roll like this. It's going to keep it easier rather than trying to do it over the top like this. Make it as easy on yourselves as possible. Have it roll like this so you have easy handling of it, okay? Oh my God, never try to do this while this is unraveled. You guys, keep this always rolled up. You have the most control over the compression that you're giving. Okay, so I'm going to start at my angle, starting at the top. The patient can hold this, you can hold this, and that's totally fine. If your patient isn't able to hold it, you got to figure it out and you got to hold it yourself anyways. Okay, and I'm always going to come across at an angle. So I'll show you guys what my first move is going to look like. I'm going to have you hold that there. A big thing, you guys, we want to make sure there are no wrinkles, right? We don't want to cause any potential skin damage. So I'm going to hold this over the top here so you can see. So I'm coming over and across at an angle here, okay? That's always going to be my first move. I want to try to cover as much ground as possible. And as I come from the bottom, I'm going to pull my slack out of it. Keep it nice and taut. I'm going to come around the bottom and loop back across the top. And as you can see, I've kind of created this X, this figure 8 mechanism. This is going to be my pattern, so to speak, as I go throughout the entire thing, okay? And around the bottom here, you want to make sure you're not getting any loops or anything happening. I don't want any loose edges, you can see there. Okay, make sure it's nice and taut. You guys can adjust this as much as you need going through. You never want to have to stop yourself, and redo the entire thing. It's the worst when you got to redo your entire limb. Okay, so I would have my patient lift their limb up here. I'm going to wrap around the back. And I'm going to come back down and kind of trace my route here. Okay, can you see this okay? Okay, and this isn't a wrinkle, that's just the underneath part. So as you go, you guys just smooth it out. I'm going to try to cover as much ground as I can here in my first few passes, trying to create my first layer of support because I need it everywhere. You guys, this needs to be covered. Like I said, you need to have 2 layers of coverage everywhere. So I'm trying to cover as much ground as I can here. Come up and around. I'm always going at angles. The more dramatic the angle, you guys, the better chance you have of avoiding that tourniquet effect. And I can see along my back here. See, I'm missing this. So what I'm going to do, I'm going to cut a slide, try to slide this down, bam, and cover that, okay? So that way when I come down and across the bottom, I just covered my whole residual end of my bottom limb. All right, so I still have quite a bit of wrapping here. And as I lift up and as I look, I'm not seeing any gaps. I may see a little, oh, not that you can see that, a little gap right there. So I know I need to pass over that again. Every which way that I lift, you guys, I should never see skin. I should always have at least 2 layers of wrapping everywhere on this residual limb. I'm going up above the knee. It's kind of my anchor. I'm not as concerned about the tautness of the top, right? Because I care that I have the most, every time I come distally, you guys, I pull my slack out, okay? So I need to make sure, bam, that I cover that side again. Good, no wrinkles. Just smooth it out as you go, you guys. If you feel like you mess up, back it up a little bit. Roll it back. If you don't like that angle, you don't like where it's going, back it up. Okay, come back around. Oh, nice and tight at the bottom. Back up to the top again. Very dramatic angles is gonna help to pull that fluid. Okay, and it's easier when the limb is actually attached to a person because then it's nice and secure for you. Okay, down again and back up. You see I keep making this figure 8 mechanism. I swoop around the back. Whoop. Okay, happens, don't lose it. Take your slack back out, roll it back up. Oh, see, and I made wrinkles here. I may need to back it up a little bit more. Hold on. Nothing wrong with it. Okay, and take your slack back out again, right? Okay, it does. It takes practice, you guys. I find it very therapeutic. Oh, it's kind of like a puzzle. Okay, I'm kind of seeing where I have repeats here. You can always reposition and move these, you guys, if you don't like where they're sitting, or if you think you've got too many layers in one spot and not enough in another spot. I'm going to come down a little bit lower to cover this. That way I can come... Where do I want to go with that? Here, that's where I want to go. Okay, always smoothing out. You guys, you can feel wrinkles as you go. So just fix it, smooth it out. Okay. Bam. Oh no, I forgot my tape. It's up there. Uh-oh. I'll have my patient hold that. Okay, here I come. I'm coming to the end here, you guys. A couple of things with the end of your wrapping. So things you want to make sure that it doesn't end up, so here's my end, my tail piece. Okay, you want to make sure that it ends up in a place that isn't in the back of the popliteal fold, okay? It's going to make it very difficult and it's more likely to come unwrapped. So make sure that as long as it ends somewhere that isn't going to get pinched or pressed, because remember, this isn't stopping your patient from moving, right? It's just elastic. They can still move with it on. So I want to make sure that I'm going to have my patient hold right here. Can you hold this edge for me, please? Thank you. Okay, so remember, no clips, none of those butterfly clips. We don't want to risk any type of skin breakdown, okay? So paper tape, athletic tape, whatever the case may be, something soft, okay? And I'm just taping off my end here. Lovely, thank you, dear. Okay, so at my end here, you guys, when you guys bring this to me, you guys are going to do a check off on this. You guys are going to bring this to me. Things that I'm going to look for. I see no wrinkles everywhere on this guy. See, I've got a little bit of a wrinkle here. Guys, all you do is smooth it out. Not a big deal. Okay, smooth it out, feel for anywhere that you have wrinkles. What else am I gonna do? I'm gonna lift this up, you guys. I'm gonna check all of your little layers here. I should have at least 2 layers every which way that I lift. Okay, so I'm gonna lift up every single place in here, okay, and check for 2 layers. I'm looking underneath. I should never see skin. Okay, we need at least 2 layers to have adequate compression throughout the entirety of our residual limb. When I look on the bottom here, I got a whole lot of nothing. It's nice and smooth. You may start to see kind of this crosshatch or herringbone pattern. If you get really good at it, it can be like a nice like crisscrossy pattern. It looks really cool. So it takes time and practice. A little therapeutic, okay? So that is your residual limb wrapping. I'm not so concerned with what's going on above the knee, you guys. Remember, the most important part of our compression is down at the distal end of our residual limb, okay? There's my residual limb wrapping.